Hey, health students. Welcome back to one of about two of these goofy videos that we've been doing here since distance learning started. Two that we have remaining that I'm going to do for you here before we get into the last topics. We may have a couple more. We'll see. We got two from this particular chapter that we'll do, and possibly one or two from the final chapter before we go off to summer vacation. So I didn't do a video for the first one from this particular chapter, but I did want to talk about the prevention and treatments of STDs. And there's a couple videos here that were really good videos. They talk about different types of STDs and what to expect. And a couple of them talk about a little bit of preventative things. But the one that you watched here today, hopefully, talks a lot more about, maybe from the female side of things, the different effects that STDs can have on the body, especially in terms of fertility for women. So, excuse me, interesting information here, but we'll get a little bit more into preventative and treatment for sexually transmitted diseases. So here we go. All STDs are preventable, and in most cases can be treated, but in some cases, some are not curable. And we'll get a little bit into that as we move forward. Prevention through abstinence. The most successful method to prevent the spread of STDs is abstinence. Some STDs are incurable viral infections, while others can be cured with antibiotics, and typically the ones we talk about that are be able to be cured with antibiotics are bacterial or parasitic. I do want to back out here for a second because there's a web page that I have attached to the outline page today that really gets more and deeper into depth as to more preventative strategies or informative information for you, is in terms of what we can actually talk about in a school setting and what we can't talk about in a school setting. We have to be so careful how we present this information so that we don't upset the wheelhouse. We can't upset either side of the spectrum, and that's why I try to be so careful about how I present this information to you. Is we can't get real deep into preventative talks because that's going to upset people with certain beliefs, and we can't not talk about it because people feel like that they're not being informed enough. So I guess the area of prevention that we really focus on, and this is kind of best practice throughout the world of teaching health education, is that we really do focus the most on abstinence being the main form of preventative, being that not only does abstinence the main form or the best practice for it, it's the only one that's 100% effective. But we do have opportunities out there that we can educate ourselves a little bit deeper into this information. So I've attached the webpage to the Center for Disease Control and Prevention. And in this particular link that I put in there for you, how can you prevent sexually transmitted diseases, get the facts, arm yourself with the basic information. And I think really that's the biggest piece that anybody needs to know, is that there's whatever we feel that we don't get within a school setting, it doesn't mean that we shouldn't know this information. It's okay to get out and open up the internet and click into probably the most informative web page out there, which is the Center for Disease Control and Prevention. And in this particular link, it talks about getting the facts. There's different links that you can talk about, and as you can see, taking control, you have the facts. Now protect yourself and your sexual partners. And obviously, we talked about this being the best practice. It's the very first one that they mention. Okay, they talk about different vaccinations so people can prevent themselves from the human papillomavirus. They talk about making sure that they're reducing partners that they're sexually active with. mutual monogamy, meaning that if you're in a relationship that involves being sexually active, that best practice in that situation is for somebody to be sexually active with only one person and not multiple. And then the use of contraception as well, specifically talking about the use of latex condoms. And in this situation, they kind of got a little section here where they can go through the do's and the don'ts. Put yourself to the test, and then just knowing your status being the biggest part. So these are different sections, and you can see on the left-hand side here where you can even kind of get into more information about testing and all of this kind of stuff. And I'm going to leave that up to you and possibly your parents to be able to kind of navigate that particular web page. I think that's probably the most informative for people. But back to what we talk mostly about here within our educational area and public education. Prevention from abstinence. Prevention through abstinence. Some STDs are bacterial infections such as chlamydia or gonorrhea that can be treated and cured with antibiotics. So like I said, if it's bacterial and not viral, antibiotics should take care of the problem. We'll just get a little definition here on antibiotics.
Antibody, a protein that acts against a specific antigen.
And that's not the definition that they have written here. That's kind of an interesting interesting definition they put in here. And antibiotics are a class of chemical agents that destroy disease-causing microorganisms through leaving the potential or the patient unharmed. So all they're doing is that the antibiotics are going in and taking care of that particular bacteria or bacteria infection. Respiratory infection. So abstinence tips. And this respiratory infection shouldn't be up here. It's kind of interesting. Some of these I should have fixed before I got through them here. So these are tips for abstinence. Go back and delete that right now. Why wouldn't I? Delete it and then come back in here. That respiratory infection did not need to be there. Tips for abstinence, and this isn't kind of in a relationship setting. Set personal limits on physical affection. Avoid dating a person who's sexually active or who pressures you to go beyond your limits. Avoid situations where you may feel pressure to engage in sexual activity, and avoid people or a person who teases you for your decisions or urges you into high-risk behaviors, including the use of alcohol and drugs. These are just situations that, and as we start to get older into our teen years and into college, it gets harder and harder to stick to that abstinence type decision that people have. And in order to be successful doing that, these are some pretty important pieces to that. Like I said, setting limits on affection. If it becomes difficult, for lack of a better way of saying it, in the heat of the moment, then don't put yourself in that situation. Maybe say, well, you tell your partner before you even start getting deep into dating that person that this is as far as I'm going to go. If it's kissing or whatever it might be, letting them know what your limits are before you get in. It sounds kind of corny, but having that conversation with somebody, before you start getting too affectionate in your relationship, setting those limits and letting them know what your limits are, because sometimes it's good to have a trustworthy person, or it is good to have a trustworthy person that'll say, you know what, this is what you said your limits were, I'm going to stop us too. So that's important. Avoid dating a person who's sexually active or who pressures you to go beyond your limits. If somebody's going to pressure you to do that, they're going to pressure you to do lots of other different things that are at high-risk behaviors. Okay, avoid situations where you might feel pressure, and avoid people who tease you. And again, I got respiratory infection up there again, and I don't need it there, so I'm going to delete it. Okay. Choose group outings. More tips. Choose group outings. You can enjoy the company of friends and avoid pressure to engage in sexual activity. Okay, don't put yourself in the situation. If you know there aren't going to be adults there, if you know there's going to be people using drugs or alcohol, that's going to make people a little bit more apt to try to do things like this. Be clear about your decision to practice abstinence and discuss it with others who are close to you. Practice refusal skills. Use words and body language to resist the pressure to engage in sexual activity. Okay? Understanding the risks, because many STDs go undiagnosed, it's not enough for a partner to simply say that he or she is not infected. Abstinence is the only way or only method that is for sure for preventing STDs. Somebody may say, well, I don't have an STD. Well, how do you know that unless you've seen their testing information? You don't really know that. And sometimes they may not know that they are infected with something. They may not be showing symptoms at the time. Avoid high-risk behaviors. To prevent STDs, avoid engaging in high-risk behaviors, including being sexually active with more than one person. Engaging in unprotected sex. Engaging in sexual activity with high-risk partners. And using alcohol and drugs, which may lower your inhibitions. Again, using alcohol and drugs is just going to put people in situations where they tend to be a little bit more risky with some of their actions. Okay? Later on down the road, somebody may choose, years later, they feel like they're in a position where they are in a relationship where they've been with that person for a while, they trust them, and they want to start becoming sexually active with somebody, hopefully after marriage, but that's not always the case for everybody. Engaging in unprotected sex isn't the best idea until both people have been tested and you've seen that testing. And engaging in unprotected sex when both partners are in a position where they're prepared for the consequences. And what I mean by consequences are, if you're in that position, you've chosen to engage in sexual activity, you're prepared to, somebody got pregnant, you're prepared to deal with that. Or you're prepared to deal with the fact that, hopefully you're prepared because you've both been tested and you know that neither person is infected with anything. HPV vaccination. The HPV vaccination protects against 4 types of HPV infections, the human papilloma virus vaccination. So vaccine that can prevent cervical cancer, precancerous genital lesions or sores, and genital warts caused by human papilloma virus infection. Okay, diagnosing and treating. Only healthcare professionals can accurately diagnose and treat STDs. When an STD has been diagnosed, a healthcare professional will prescribe something effective, some kind of medication, or monitor the patient's treatment as well. So just going on some sort of antibiotic on your own to try and take care of this because you want to deal with this situation on your own is not advised. Only advised for somebody to get medical supervision as to how they're going to be treated. Don't just try to treat it on your own. Teens who believe they may be infected with an STD should talk to a healthcare professional. Many public health clinics provide information and treatment free of charge. So that is something that takes place. There's lots of different places where people can go in the healthcare field. And many places, like you said, are places where they can do this free of charge and it doesn't cost the patient money. Okay, act responsibly. Act responsibly to prevent the spread of STDs. And we talk about the 2 biggest things that people can do, the 2 best practices in the world of health are to practice abstinence and report known infections. And that's really a huge responsibility for somebody. That it's not always doesn't always feel the best for somebody after they've been infected with something and they've been tested and they test positive for an STD. It's not like people feel like going out and shouting from the rooftops that they have an STD, but it is important for them to report those, and they always are reported. When you go to a doctor's office, it's just like if somebody went to the doctor's office and tested positive for a virus like COVID-19, If somebody went in, tested positive for